Hi and welcome to this first video in a series of videos where we're going to look at planning a simple palliative pelvis patient. And really the idea of these sessions is to give you an introduction to Eclipse and how to use it, and for you to get some experience of using some of the tools. So you should hopefully be logged into your PC by this point, and to launch Eclipse we need to double click on this user home icon. And then the username and password for the Eclipse station is depending on which station you're sat on. So you'll have a number in front of you. So say I was sat in front of Eclipse number 2. I type Eclipse 2 there, and then I shall let you know the password on the day. And we'll click OK. And then this takes us to the home screen for Eclipse. It may look very slightly differently in terms of, you may see some things displayed in this area here, but essentially it should look pretty much the same as you can see here. So we can see there's some tabs across the top. So these tabs here, to be honest, aren't things that we're overly interested in. So if we were in a clinical department, these what we could use, as you can see, to schedule our patients, etc., and tasks that we might have to do. So the area we're interested in is these quick links here. So this is going to take us to the modules that we want to use, and you can see here there's a number of different modules which do lots of different things. The two that throughout the course we'll be interested in are going to be these two, the imaging one and the treatment planning. For today's purposes we're interested in the external beam planning one, but as you can see the rest of them are fairly self-explanatory. So if we were doing some brachio planning, clearly we'd go in there. If we wanted to do some contouring, we would go in there. So we're going to go to external beam modelling, because I've already created a patient for you and contoured the patient. So you're going to have a go at doing some planning on a pre-contoured patient. So this is what you might do if you worked in a planning department, where the clinicians contour the patients and then they move into move the patient data to you to plan the patient. And so here we are in the external beam planning module of Eclipse, and because it's a window-based system, you'll be used to seeing a lot of the icons that you can see across here. So there's a number of different things we're going to do when we're carrying out these practicals, and you can see lots of them. We can select things in the menus, for instance a new plan, or there's shortcuts as well with lots of other Windows software. So if we, for instance, wanted to create a new plan, we would hit F8 and that would do the same. There's a number of icons across the top which we'll talk about when we come to use them, but similarly, as you'd see in other Microsoft things as well, as you hover over them it tells us what they do. Okay, and in these sessions I'd really encourage you to have a go at seeing what all the different tools do. You can't really break Eclipse, he says, so have a go at seeing what the different tools do, and that's the only way you can, I guess, really get experience of what everything does. And then this is where we're going to view our patient, and then we can see here when we eventually have a plan we can select these tabs, and there's a number of different parameters here. So let's make a start and we'll have a go at opening our first patient.